What's up, y'all? It is now 3 weeks and 1 day since my surgery. It's going pretty well. I'm crossing my leg. I'm getting pretty hopeful for it. This one, and then there's a little bit of pain with that, but not like hurts pain. It's more just like stiffness. Getting there. Honestly, it's just been like touch and go, testing it a little bit, and then a lot of massaging the tendon. I think that's been helping a lot. I haven't been icing much. I've been more like moving blood around in there. A lot of massaging, and then more so heat, and then massaging like within that, getting some Vaseline in there, trying to help out the scars and whatnot. That's all, yeah, it's all just aesthetic. But yeah, it feels good. Still getting more and more mobility. Every day it's like small little wins, and it's getting there. Yeah, I can squat. I can get out of chairs. It's a little bit painful. It helps to come out here, like really, really wide. Using more glutes. Not putting so much pressure on the quads right now. Been doing a lot of hamstrings, a lot of like posterior work. So I have a weak posterior regardless. So still feel like I'm not even in balance. But yeah, hopeful. Only 3 weeks out, so I still got 3 more weeks until I'm like fully recovered. Still not jogging yet. A lot of incline work. So I'm on the treadmill on incline at like 4 miles an hour, 3.5, for maybe 5 minutes on, 5 minutes off, 5 minutes on, 5 minutes off. Going backwards on that same incline at like 10 to 15 degrees and just kind of walking backwards, getting my knee over my toe, which is something I've been testing out. A lot of backwards walking. It's good for the stability around the knees. I got into it just before my surgery and felt really good. So yeah, I'm gonna continue that. It's nice to find those like weak points, I guess, where I'm shaking. And you can see the muscles kind of like flaring up, and in here in that vastus medialis. It's just not stable yet. It doesn't really trust the pain. It's like it knows that there's still an injured knee, so it's like really tensing up and trying to find stability. And so it's touch and go. A lot of static work where I'm kind of holding certain positions where my quads need to be firing, but just kind of keeping it there, like a wall sit or something. I don't do wall sits, but something like that. In a split position, holding positions, or like a goblet squat position, trying to go low, hold for as long as I can, kind of pulse up, find that. So it's like weird stuff that I'm doing. I'm doing all my own physical therapy, but yeah, just testing things out. Every maybe 3 to 5 days, I'm pushing it again and like trying the bike, or trying some more weight on the goblet squat, or whatever it is, just like hardly testing it, and then walking a lot, just getting a lot of mobility. It's getting stronger every day. So it's also being patient, like knowing that your body's going to eventually get back to it. but also, you know, walking around is not bad. I think it helps my knees, honestly, gets the blood moving. And then I'm using a lot of knee sleeves, a lot of the neoprene, like wetsuit type of knee sleeves. Helps keep the blood flowing in there. And then I have like a knee warmer, so I plug it into the wall, I put it around my knee, and it's just easier. Like if at night it's feeling a little bit stiff or whatever, I'll put it on some heat, go in there, massage my tendon, push it around, get around that bump, and just kind of like move it around. Like I just did that for maybe 30 minutes and they feel great right now, which I didn't realize was the thing to do, but like I just did a workout and, you know, they were feeling stiff, so I sat there and made sure I rubbed them out. And yeah, I don't know, massaging tendons is something that I did not know about, especially for like Osgood, Schlatter, like tendonitis type of, you know, on your knee or elbow or wrist or whatever. I guess I was always scared to like go in there and touch it, I don't know, but really going in there and like breaking up that scar tissue or whatever is developing in there really helps out. Let's see, anything else? Yeah, that's about it. But yeah, if you're, you know, I've been talking to some friends, you know, about autoimmune diseases, about vasculitis or lupus or eczema or, you know, something like this where you don't really know what the issue is. If you've been seeing professionals about this, just know that like there's more information on the interweb than with one doctor. And like I know that seems like super rational and like, yeah, no shit, but like keep that in mind. If you're going for answers to say 1, 2, or 3 doctors, like, and then you're giving up because of, you know, no answers at these 3 doctors, like realize that 1, they're just one person, you know, like they can only know so much. 2, the internet is vast, you know, like there's way too much information on the internet, scholarly articles. If you don't know how to do that, look up a YouTube video for that, and then go on to Google and find different research studies on scientists that have really tested this stuff. 3, it's super nice to know that like someone's actually working on this, like professionals are working on this and you're not alone in this. Like enough people have had this thing, whatever it is, that people are researching it. And for like, what was the last, yeah, there, just don't give up on it just because of you know, one doctor not knowing. There's a lot of research out there. Yeah, I'm blanking on the last point that I was gonna make, but yeah, just keep searching out for it. There's hella information out there, and even you could bring up this stuff to your doctors or, you know, whatever it is, and just try it out yourself. You know, have the confidence to take that leap and like explore the body, connect with it a little bit, and really try to rationalize all of those ideas. And I don't know, you're the only person that knows your body as well as, you know, you can only feel that. Try to figure out the balance, try to figure out how to not give up on this stuff. There's answers, like there's ways of making it better. But yeah, that's all before I'm already at 10 minutes, dog. Peace out, y'all. Take care.